Friends, I am Dr. Ghosh. Welcome to my channel, Dr. Ghosh Presents. Homeopathic remedies for asthma. What is asthma? Due to special type of inflammation, air carrying fine tubes within the lungs become narrower, leading to want of oxygen in lung tissue. The subject suffers from breathing troubles, cough, and pants. This situation is called asthma. On the right hand side, the pictures, look at the pictures. These are the tubes. This is healthy tube. This is affected, that is diseased person's tubule. The same thing here. This is normal. This is diseased. Accumulation of fluid due to inflammation of tubules or tubes within the lung. What is the average incidence of asthma in India and Bangladesh in a year? Average incidence in a year, Bangladesh approximately 1 crore, India about 10 to 11 crores. What are symptoms of asthma? Number 1, cough, wheezing in chest. Number 2, pressure and pain in chest. Number 3, trouble in breathing. Number 4, difficulty in sleeping. Number 5, weariness. What are the reasons of asthma? Real cause is still unknown. Scientists think what with hereditary factor and what with environmental factors are the main cause of asthma. That is partly environmental and partly hereditary factors, the real reason, but true reasons is still unknown. What are triggers of asthma? There are few things called allergens in environment and a few state of health which initiate signs symptoms of asthma. These are called triggers of asthma. Examples: airborne pollens, fine insect, dander of cats and dogs, remnants of dead bodies of cockroaches, fungi, spore, etc. Number 2, flu virus. Number 3, cold wind. Number 4, physical exercise, tough labor. Number 5, smoke, gases arising from chemicals, toxic things. Number 6, tremendous stresses. Whatever said here, it is displayed in the picture here. How to prevent asthma? Number 1, avoidance from exposure to all triggers. Number 2, avoidance of passive smoking. Number 3, keeping body weight under control. Number 4, preserving immunity by doing some physical training daily, taking fresh veggies and fruits daily, taking salt, sugar, saturated fat less, avoiding all addictions, taking ready food and drinks less, having deep sleep for 6 to 7 hours daily, avoiding tension, avoiding being tab happy or cab happy. That is, the person who used to take tablet or capsule, the slight pretext. This endanger the immune system also. Mind it. If you do not give your system to react, at the very onset you give some medicine like paracetamol, which suppresses your system and you feel very nice, very mentally very happy, because the medicine acts, that action of the medicine actually, what happens, it goes deep and it suppresses the immune system, so temperature or other sufferings is less, but actually not, that is not a medicine. This acts in a separate way, affecting your brain to take the that the system which cause absorption of pain symptoms or other absurd distress symptom, that will be less and you will feel some happy feeling. That is fully cheating. That is being done by most of the modern medicines. Which are most common homeopathic medicines for asthma in children? 1, chamomilla, 2, ipecac, 3, netamsol, 5, pulsatilla, 4, pulsatilla, 5, sambucus. All has been described, details later on. Aralia racemisa for asthma: high pitch wheezing and cough, coughing, sneezing from tickling in throat, worse in the evening, night after sleep, suffocation unless sit up, pressure in chest as if something stuck in throat, expectoration warm, salty, profuse sweat in sleep, rawness and burning behind sternum. Spongia for asthma: furious cardiac asthma. Cardiac asthma is something special type. It will be discussed later on in details. Trachea dry, whistling, everything is dry, no mucus at all. Awakes in a fright and feels suffocated, as if he had to breathe through sponge. Worse from sweet, cold drinks, smoking, dry, cold wind, reading, swallowing, singing, talking before midnight. Better from eating warm drinks. Arsenicum album, actually, album is not there. Arsenicum album in asthma. Spasmodic type of periodic attack. Worse at 2 p.m. and 2 a.m. From cold wind, from lying, movement, subjects jump out of bed. Feel better when sit with body bent forward. Calicurb, calibacrum, lacan, spongia all has this symptom. When rock back and forth, from heat, from warm drinks, burning in chest, excessively weak, restless, anxious, fear from death. These are general symptoms of arsenic. All arsenic patients feel these symptoms. Some type of burning, very weakness, restlessness, anxiety, and fear of death. It's common symptom, but these are most important symptom for arsenic. If you choose arsenic, you must see that patient has at least this 2 or 3 symptoms from this group. Otherwise, he is not a patient of arsenic. Calicarbin asthma. Aggravation from 2 a.m. to 4 a.m. while lying, drinking, from movement, cold wind, arsenic. Better from sitting upper part, slanting forward. Resting head on table while sitting, rocking body to and fro, arsenic. Sensation as if there is no air in the chest. Acute nap for asthma. Trouble start from fright, shock, annoyance, cold wind, cold dry wind. Hipper spongia has the same symptom. Sudden furious type of asthma, sit tightly erect. Face full of fright, profuse sweat, anxious. Cannot breathe properly, pulse thread-like. Patient very restless, fear of death, face red, eyes wide open and fixed. Ipecacuanha for asthma. Acute breathing difficulty with wheezing respiration in chest, anxiety in precordial region. Now what is precordial region? I have underlined it, precordial region. Precordial region, in the place of image of the medicine, I have given this. Because this, I think this is most important. Many body may not know what is precordial region. Precordial region is this region where the heart lies and the portion of the chest wall related to this heart is called precordium. This area is called precordium. This is because it is the apex of the heart and this is the base of the heart. The region of pectoral wall, that is chest wall, in relation with the heart is called precordium. Asthma owing to bronchitis, suffocation from cough, vomits. Body becomes stiff, face becomes red or blue, sometimes a little blood comes up. Much useful for children. Ipecac, very important for children. At night gets up from sleep to sit on bed, moves to open window, gasping for air, feels better in open air. This is also has in pulsatilla. Ending tart for asthma. Breathing trouble, has to sit supporting chest with pillow. Loud rattling of cold in the chest but unable to cough up. Ipecac has got same symptoms, but he can cough out. This is especially observed in children and aged patients. Patients perspire profusely in a drowsy state, sometimes seem they were in coma, face pale, comatose, abhor foods, nausea, no thirst, irritable, can tolerate nobody but like solitude. Camomilla for asthma. Asthma after getting angry, arsenic, Rastux, ignatia. Suffocation feeling from breathing troubles. Trachea as if tied with a rope. Feels better when sit bending head backwards. Better in cold air and from cold foods. This medicine is predetermined for old men and children. Dry, hard cough. Cough while sleeping. Get angry while coughing. Cannot tolerate troubles. Irritable, capricious. One part of face, that is or cheek, same thing. One part of cheek hot and red, while other part pale and cold. Naza for asthma, a great remedy of cardiac asthma. Now I have given a star here. I will just describe differentiating picture of cardiac asthma from ordinary asthma. This cardiac asthma, you can get it in cactus grandiflorus, aurum, lichen, etc. Patients cannot lie down, especially on left side, feel suffocation, gasp for air, heavy palpitation in chest, cannot talk, words get inaudible. Breathing trouble starts from rhinitis. This is USP. USP means uncommon, strange, peculiar symptom. Breathing trouble starts from rhinitis. From nose troubles, the breathing trouble starts. This is a very peculiar symptom. If you get this symptom, you can blindfoldedly give nausea to the patient. It is such an important symptom. Lycopodium for asthma. Asthma, abdomen bloats up with asthma as if it would burst out. Subject loosen clothes around waist. Breathing difficulties from lung cause. Creases on forehead in pain. Creases on forehead as if in pain. Alanasi swells up. Now what is alanasi? This is called alanasi. This portion is called ala. Alanasi. It's plural. This is alanasi. This is swells up in lycopodium. Unable to expectorate mucus. In zinc we can get this symptom also. One cheek red, the other pale. Worse between 4 p.m. to 8 p.m. Now, truly speaking, cardiac asthma is not an asthma. Breathing distress, bloody frothy sputum, orthopnea. Orthopnea means actually the patient cannot lie down. He has to sit up. Whenever he tries to lie down, there is severe breathing difficulty. Cyanosis, that is blueness of face, excessive fatigue, swelling of leg, feet, ankle are seen due to left ventricular failure leading to pulmonary edema. Mind it, cardiac asthma is actually due to pulmonary edema. Now what is pulmonary edema? See, we know that blood comes from lung to heart first in the left chamber. In the left chamber, there is left auricle, then left ventricle. Now there is a valve. It's called mitral valve. Now if the mitral valve is in disorder, sometimes what happens? Whatever blood is coming from lung, the heart cannot accommodate it because that particular flap or valve has gone out of order. So what happens? There is a pressure in the left ventricle of the heart. That pressure go to back and it creates a back pressure in the lung also. So what happens? In the lung there is pressure of blood in the lung tissue increases, and what happens? This blood fluid settles in the tissue of lung, and that is called pulmonary edema. This is a very, very grave situation. Many patients die from pulmonary edema. This pulmonary edema actually causes this cardiac asthma. There are many symptoms like asthma, but it's not truly it is not asthma because it's fully from cardiac cause. Actually, left ventricular failure is due to left ventricular failure. Like this for asthma, breathing distress starts in sleep. Still subject sleep. Distress has started in the sleep, but still he is sleeping. Distress may start after waking up sleep. That is, sometimes distress starts after waking up sleep. Better feeling when seated, slanting forward. Worse from obstruction of nose, mouth, touching throat, moving hand, talking. From slight things, the lycosis patient feels aggravated. Lights, door, windows, everything open. This symptom is also there in Apis mellifica, pulsatilla, sulfur. A fitting remedy for cardiac asthma. Just we have described cardiac asthma. Cardiac asthma, mind it, This is a very rare type of disease. If you give it a particular medicine, the patient will bless you profusely, because cardiac asthma is very painful and severe thing. Shorinam for asthma. Breathing trouble with palpitation and anxiety. Worse when sit up. Better lying down, extending hands on both sides. Worse in open air. Thinks he would die. Almost a specific remedy as if asthma arises after suppression of skin disease. Arsenic, sulfur, graphitis also. Suppression of skin disease, asthma, these four medicine. Shorinam, arsenic, sulfur, graphitis. Shambukas in asthma, especially for children. Attack starts at 3 p.m. Jumps, Kalikarb also 3 p.m. Jumps out of bed. Arsenic has got this symptom. Face becomes cyanosed due to breathing distress. Gasp for air. Thinks he would die. Then he goes to sleep. Again gets up. Trouble of breathing start. This cycle goes on. Feels well when he is awake. Troubles begins in sleep. Body hot while in sleep, but arising from sleep, profuse sweat. This is also seen in lachesis and Aralia motion. Netum sulfur asthma, severe discomfort of 4 to 5 p.m. 4 a.m. to 5 a.m. that is morning. Worse in warm, moist weather. Lying on left side. Intense dyspnea, cough, profuse greenish acrid expectoration. Bottom of left lung affected with pneumonia. Left side of chest sore and painful. Especially adapted for children. Netamsal children. They start to wake up and catch hold of their chest. Pulsatile asthma, especially adapted for children, after suppression of skin disease or suppression of menses in women for hysteric ladies. As if throat and chest are pressed by someone, as if sulfur fume filled up the chest. Increase of trouble in the evening and after meal. Pulsatile are subject to polite, timid, obedient, weep easily, and want sympathy, cannot tolerate heat, want open air, hunger is their hunger is less, almost no thirst. They do not suffer from constipation. Symptoms, physical and mental change frequently. Pulsatile patient is very much, you can identify it from this general symptoms of pulsatile, this line, from this paragraph. The pulsatile patient, these are the generalities of person, pulsatile. Whenever you give pulsatile to someone, he must have a few symptoms from this group. Salicylic for asthma. Asthma of wet weather, rumbling within chest as if filled with mucus. Respiration would stop. Best for old psychotic patient. Asthma of children, face pale, waxy, very much tired, thirsty. Asthma after suppression of gonorrhea or sweat, worse in cold or during thunderstorm. Profuse offensive sweat on scalp at night.